The patient is disoriented and combative and accusing the MS team of stealing her purse. These are all telltale signs the patient is suffering from schizophrenia. What is schizophrenia? Schizophrenia is a chronic brain disorder that affects less than 1% of the US population. There are two types of manifestations, which are positive and negative symptoms. Positive symptoms tend to be exaggeration of normal function, such as hallucinations, which means the patient may hear or see things that aren't there. Another positive symptom is when the distortion of thought processes, which manifests as delusions. Negative symptoms include terseness in speech, apathy, and social withdrawal. What causes schizophrenia? The cause of schizophrenia is unknown. However, onset affects men earlier in life compared to women. Schizophrenia can occur at any age, however, the onset tends to be in late teens to early 20s for men and late 20s to early 30s for women. What are the risk factors for schizophrenia? Genetic factors, environmental factors, and life stressors contribute to disorder's onset. Also, difference in brain structure, function, and interaction among chemical messengers may contribute to schizophrenia. However, there is an exact factor that can be pinpointed to the disorder. The patient is suffering from schizophrenia because she is delusional, which is a positive symptom. She thinks the EMA worker stole her purse, however, they are trying to help her. She was also hostile towards the jogger that she encountered because she yelled obscenities at them. Nonetheless, she was also hostile towards the doctors and nurses because she was yelling at them. Furthermore, the patient is combative and hostile, and people that have been diagnosed with schizophrenia often showcase these signs. Aggressive behavior is often found in paranoia schizophrenia, and the patient is paranoid because she thinks someone is trying to hurt her and steal from her. She is also disoriented because she doesn't know the difference between reality and delusion, and it's causing her to act in a bizarre way. Also, she didn't know where she was going in the park because she was wandering around. She had no sense of direction. Another telltale sign that she has schizophrenia is that she also has poor hygiene because she smells of urine and stale body odor. This is a negative symptom in schizophrenia. This type of deterioration of letting personal hygiene go stems from general apathy or lack of motivation. There are many different short-term health risks she is prone to, such as inability to maintain relationships with friends and family members. People that are suffering from schizophrenia often withdraw and isolate themselves from others. In addition, people that experience a great amount of paranoia like the scenario above, can be extremely suspicious of others, which leads to them avoiding people they know and meeting new individuals. Schizophrenia also interferes with normal daily activities. The symptoms of schizophrenia disturb normal daily functioning. Tasks that were once easy to complete before become difficult to complete. Oftentimes, delusions and hallucinations can interfere with the ability to maintain normal hygiene. The last health risk that may be a risk for is substance abuse issues because many people that abuse alcohol or drugs tend to not adhere to their medication schedule. There are many long-term risks the patient is at risk for, such as greater risk for developing metabolic syndrome. Metabolic syndrome is a group of factors that increase risk of cardiovascular disease and diabetes. Risk factors include obesity, high blood pressure, and abnormal lipids in blood. Another long-term risk is death. Also, inability to go to work or school. And lastly, they become depressed and also demoralized, which causes them to self-inflict, therefore increasing the risk of suicide. The patient's hands are shaking because she has developed tardive dyskinesia, which is a mild to severe twitching, shaking, or jerking in the hands, feet, face, or torso. Tardive dyskinesia is associated with certain prescription medications used to treat mental health conditions such as schizophrenia, bipolar disorder, and depression. 1 in 4 people who are taking certain mental health prescriptions may develop uncontrollable movements of tardive dyskinesia. Drugs that cause tardive dyskinesia include antipsychotic drugs and tricyclic depression medication. What is causing the patient's confusion is the patient has cognitive impairment because of schizophrenia. As they grow older with the disorder, there is a significant decline in intelligence. Also, the patient is going through a psychosis episode which disrupts a person's thoughts and perceptions, and it makes them not be able to recognize what is real and fake. This leaves the patient confused and frightened because of psychosis symptoms. What is causing her combativeness? Aggression is a complex phenomenon influenced by genetic, neurobiological, and psychosocial factors. Aggression is caused by the impairment of many neurotransmitter systems such as serotonin, dopamine, and norepinephrine are implicated in the biology of aggression. Nonetheless, aggression behavior are often found in paranoid schizophrenia patients. Psychotic symptoms such as delusions and hallucinations with subsequent suspicions and hostile also result in combativeness, which is what the patient is experiencing. The patient will need to go through various assessments. An MRI and CT scan should be ordered to rule out disorders that can cause psychosis, such as vitamin deficiencies that aren't related to schizophrenia. Also, ventricular brain ratio should be looked at through a CT scan since VBR in schizophrenia patients is higher. Also, a physical exam should be done. Nonetheless, also have the patient describe distressing experiences and perceptions. Also, a blood test should be done to rule out conditions that have similar symptoms such as alcohol and drugs. And also ask them questions that determines if they are hallucinating or preoccupied within their own state. In most mental health disorders, it is difficult to implement rehabilitative programs without medication. Although psychiatric medications don't cure mental illness, they help improve symptoms. Patel from PANIC stated that the goal in treating mental disorders includes targeting symptoms, preventing relapse, and increasing the adaptive functioning so that the patient can be integrated back into the community. Patients rarely return to the baseline level of adaptive function. Therefore, non-pharmacological and pharmacological treatments must be used to optimize long-term outcome. There are many different medications that can treat mental illnesses, such as antidepressants, which treat depression, anxiety, antipsychotic medication drugs, which are used to treat disorders such as schizophrenia, mood stabilizing drugs that treat bipolar disorder, and anti-anxiety medication that's used to treat anxiety disorders. Psychotherapy is also another form of therapy, which is also known as talk therapy. Psychotherapy helps the patient to learn how to cope and learn stress management skills. There is also brain stimulation treatment, which is used when psychotherapy and medications haven't worked. Types of brain stimulation includes deep brain stimulation and vagus nerve stimulation. Lastly, the patient can also check themselves into a psychiatric hospital, which will also help them with treatment if they're inflicting harm on themselves or close to harming other people that are around them. Mental health insurance is outright horrendous. Many health insurance plans lack an inadequate amount of in-network providers. Due to this, it causes patients to wait for long periods of time before getting treatment. They have to travel distances just to get to an in-network provider. Also, they have to see a professional outside of their network at a high out-of-pocket cost. A 2019 report found that a behavioral health office visit is over 5 times more likely to be out of network than a primary care appointment. Patients have a hard time finding in-network, which forces them to go out of network. Also, it's hard to find information regarding in-network providers. Nonetheless, many mental health professionals don't accept insurance because they don't make enough money off of insurance companies, so they prefer out-of-pocket. Lastly, health insurance companies have very strict standards to limit coverage for mental health, which makes it difficult for the patient to get treatment unless they are very ill.